Do you injure your knee playing basketball? Today we're going to go over every structure that could be injured while playing basketball, or some of the most common knee injuries in basketball. So we're going to start off here. Here's the knee model. Here's the outside part of your knee. This is the inside part of your knee. So we're going to go over every structure that's kind of like most commonly injured while playing basketball. So here we have the quad tendon. So this is the big quad muscle. It attaches to the quad tendon, and the quad tendon goes to the kneecap. Sometimes some people have tendinopathy, kind of like the jumper's knee, but here in the quad tendon, you might also have some tendonitis here. Other injury that we have is here's the kneecap. We might have patellofemoral pain syndrome, and that has certain different factors, but pretty much the kneecap giving pain, and it could be caused by one, abnormal tracking per se, or also just increased compressive forces on the kneecap on that knee joint. We also have here in the patellar tendon is jumper's knee, patellar tendonitis, one of the most common ones. And then here in this little bump, the tibial tuberosity, we have Osgood-Schlatters. That's common with younger basketball players. On the inside, we have the MCL ligament. That happens on a contact injury or even non-contact. When the knee dives in too much inside, stressing this ligament, it might lead to a grade 1, grade 2, grade 3 tear. Usually these you don't need surgery for, and it's more conservative care. On the outside, we have the LCL ligament. So whenever someone goes out to the side too much, it stretches out that ligament and gets partial tearing in there, grade 1, grade 2, grade 3. These are least common, it's more common for the MCL going that way. Deep inside the knee joint, we have the ACL ligament, the anterior cruciate ligament, and the posterior cruciate ligament. And these ligaments, the most common one is the ACL. PCL is not as much common in basketball, but the ACL gets commonly torn with a lot of girls tear this ligament, and also just overall in basketball players, this is one of the most common ligaments that's torn. And these, you might not need surgery, and you're gonna be out for at least a year. Inside the knee joint, we have the meniscus. So the meniscus, we have a medial, which is part of the inside, and then we have the lateral. And we have different zones in there. We have the red zone, white zone, depending on the blood supply. But these, you need surgery if they're locking up or catching on you, so the knee kind of locks up, catches you. But a lot of people have torn meniscus and they're still playing basketball. I have a torn meniscus on my right knee and I'm still playing basketball. Other common injury that we have is actually here in the knee joint itself. We sometimes have cartilage injuries. So cartilage injuries are actually in the bone, and that's what is the really scary injuries. That over time leads to those cartilage injuries, and that's where your knee swells up. Greg Oden had those injuries. Kobe had a cartilage injury. Over time, you have those cartilage injuries, which your knee might swell up out of nowhere without no specific true mechanism of injury, and those are the worrisome because it hits the bone, it injures the actual bone itself. Another injury that we have that's not so common, but it's pretty common, is those bone bruising. So the bones hit each other. It's kind of like a cartilage injury, but a bone bruise just hits each other, not enough to really injure the cartilage itself, but injures the bone itself, and it causes some swelling and pain. So those are some of the stereotypical or most common injuries that we see in basketball.